Dear colleagues and friends, greetings from the World Health Organization's Department of Sexual and Reproductive Health and Research and the UN co-sponsored Program on Human Reproduction, HRP. With apologies, I'd like to go off script just for a minute. I'm usually an eternal optimist, but things are not looking good, and it would be great if at some point during the meeting we could all take a moment to spare a thought to all friends, colleagues, and populations living in conflict, strife, and settings in which their rights are being violated. The global context presents a particularly different time in which to promote sexual health. History tells us that in difficult times, there is a tendency to regress to traditional values. It is important that we acknowledge and bravely take on this extra layer of complexity with rigor, determination, and integrity. I am proud to be in WHO and HRP at a time when the working definition of sexual health, and indeed a program in sexual health across the life course, emphasizes a positive and respectful approach to sexuality and sexual relationships as integral to sexual well-being. This year's theme, Bridging the Gaps, is apposite. We have a challenge to bring together an unprecedented openness towards healthy sexuality with a loud anti-rights movement which calls into question key aspects of sexual health. We need to strengthen the evidence for comprehensive sexuality education, the protection of bodily autonomy, and the protection of sexual orientation, gender identity, and gender expression. The World Association for Sexual Health brings together commissioners, producers, providers, and consumers of evidence-based information, education, services, and support to ensure that everyone is able to fulfill their sexual and reproductive health and rights. We look to you also as ambassadors to integrate sexual health considerations where they've long been overlooked, including in primary health care and in the promotion of health across the life course, recognizing that as sexual beings, we are more than just reproducers, we are also producers of health, wealth, and well-being across the life course. Several of my wonderful WHO and HRP colleagues are with you in Turkey. We are delighted to champion our research on sexual pleasure. We will be launching a resource to improve global data collection on sexual practices and forecasting a future where comprehensive sexual and reproductive health services are responsive to the needs of all. I hope you are able to engage safely and robustly in honest conversations about how we collectively address the conservatism that constrains effective, comprehensive sexuality education. I send my very warm congratulations to Dr. Chandra Molly, who is being honored at this year's conference for a career dedicated to advancing the sexual health and rights of adolescents and young people everywhere. Thank you to the WAS Executive Committee and its members for many years of collaboration on sexual health. As our own work on sexual health continues to grow, so too, I hope, will our engagement with this community. I wish you an excellent Congress.